absolutely good house remedies available. This is the exercise we do. This is strengthening the thigh muscles, what we call the quadriceps. So all patients with osteoarthritis should meet a physiotherapist for rehabilitation program. Now what we do, if people are not able to walk, we give them aids and appliances like a walker, we give them a walking stick. So all these things are available in the country today. In addition, they have physiotherapy modalities like wax, interferential therapy, which will all be decided by the physiotherapist. Ultimately, they don't settle, then you have to do a joint replacement. And this lady was remarkably fine, able to walk well. In fact, she went abroad nearly about 8 to 9 times after a joint replacement. The last one is gout. So I did speak to you about rheumatoid arthritis, which affects the smaller joints of the hands and feet. Then I spoke about osteoarthritis. The next one will be gout. You get swelling of the big toe. This is quite common, and it is due to elevated uric acid in the blood. It is elevated to uric acid in the blood. Like how diabetes is due to elevated blood sugar, uric acid, when it goes up in the blood, will get deposited in the joint and it will cause gouty arthritis. Just one word. How does gouty arthritis come? It manifests a sudden pain and swelling in the big toe. It is genetic. Occurs more in males than females. You can ask me, Ramakrishnan, why does it spare females? Why does it only affect only males? The female hormones, they facilitate the excretion of uric acid. So they usually have a normal uric acid. And gout is a disease which requires lifelong treatment. It is like diabetes. I see majority of the patients with gout do not follow the treatment. They are absolutely disciplined not to follow the treatment at all. I don't know whether it's indiscipline, but they're disciplined not to follow the treatment. If you have gout, please continue your treatment lifelong. That's very, 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 very important. What food to be avoided in gout? Number one, never be a glutton and never take mutton. What I meant is, patients with gout should avoid non-vegetarian foods, especially red meat. Number two, avoid alcohol. You can have your pulses. We don't take 1 kilogram of Bengal gram per day. You can, if you go into the internet, they'll say you avoid this, you avoid spinach, you avoid cabbage, you avoid cauliflower, you avoid broccoli. Ultimately, you won't have anything to eat. The only thing which you need to swallow is your own ego. Nothing you can have for food. It's not like that. Avoid high quality purine food like non-vegetarian, especially red meat. Better to avoid. Some people will say, can I have fish? I said, no fish. They say, can I have small fish? Then I tell them, you're fishing for trouble. Whether it is big fish or small fish, it is only fish. My point is, even if you have it in limited quantities, I feel people Sunday enjoy the ecstasy of having non-vegetarian food. Lot of red meat. Monday morning wants to go to the hospital, but the cost to the office, he develops acute gout. So you have to exercise restraint as far as food is concerned. So lifestyle modification, just no fasting and feasting. That's very important. Even if you fast and feast, you can get into trouble. And see that fellow, he's totally drunk. I don't know where he got so much of alcohol. He doesn't know where he's walking. All of us, in fact, do not know where we are walking in life. This fellow is taking alcohol, his spirits are very high, and he doesn't know where he's walking. Nice. Test to be done for gout is uric acid. Then last 3 slides. We finished rheumatoid, we finished osteoarthritis, you finished gout. Now there is osteoporosis. Osteoporosis is a condition in which the bone, the spine bones become very, very soft due to leakage of calcium. And these people, when they fall, they can easily break their spine and hips. The commonest fracture which occurs beyond the age of 60 years is the hip fracture in people with osteoporosis. That's very, very important. Osteoporosis is seen in India, it is seen in the urban areas, it is seen in the rural population, it is seen in the rich, it is seen in the poor. It doesn't spare anybody. It occurs more often in people after the age of 60 and in women after menopause, because our female hormones, they protect the leakage of calcium from the bone. So osteoporosis is very, very common in the elderly, very common in women after menopause, and very, very common in people who take steroids for a long period of time. That's important.